We restricted certain types of hospital procedures to create capacity. We deployed teams to nursing homes to support our most vulnerable residents. We placed additional restrictions and capacity limits on our employers and our businesses. As a result, we freed up hundreds of hospital beds, we reduced mobility, and created more space for people to move around safely through the capacity limits we put in place in all industries. We repeatedly begged people to stay home for the holidays this year and discouraged celebrations with loved ones outside their household. I saw several really impressive versions of Charlie Baker as Scrooge on social media. This was on top of our daily reminders to please wear a mask, avoid informal group settings, stay home when you feel sick, wash your hands, and try to spend as much time as you can with those in your immediate household. I think, as most people know, post-Thanksgiving, we had a significant spike in cases and hospitalizations. Christmas through New Year's added to the strain on our hospital system. These have been long and hard days for everybody, but our hospital system was able to continue to provide medical care for our residents. And today, 3 weeks into 2021, our public health data is trending in better direction for some categories, like hospitalizations and the percent of positive COVID cases, for the first time in a long time. Hospitalizations are down by 10% since they peaked in early January. Today we have 2,209 individuals in the hospital, which is down from 2,428 on January 4th. The average positive test rate for COVID-19 has gone down by 33% since the beginning of January, from 8.7% to 5.8%. The 7-day average of cases is also down by about 30% since its peak in January, from 6,120 down to 4,528. We all know that we are not out of the woods yet by any means, but things do appear to be getting a bit better here in Massachusetts. Vaccines are here. We were just at Gillette Stadium this morning, where the state's first mass vaccination site is accepting patients. Massachusetts is now vaccinating all residents in our Phase 1 priority group, and we're making progress to get shots in arms for our most vulnerable residents and frontline healthcare workers who have been bearing an incredible amount of risk and burden throughout the pandemic. We can't move fast enough to vaccinate our residents, and we're building a big vaccination infrastructure to provide convenient, safe, and equitable access to vaccines for every resident in Massachusetts, no matter where you live. For more information on this, residents should visit mass.gov/COVID-19 vaccine in Massachusetts to learn when and where they can plan to get a vaccine. Vaccines are reaching residents, positive case rates and hospitalizations have stabilized. Those trends are moving in the right direction. As a result, we believe it's okay and it's time to start a gradual easing of some of the restrictions we put in place in the fall. Effective Monday, January 25th at 5 a.m., the early closure business order and the stay-at-home advisory will be lifted. These are the restrictions we put in place in early November that required many businesses, such as restaurants, health clubs, movie theaters, and others, to close at 9:30 p.m. and the corresponding health advisory that went with it. At this time, we're keeping in place the across-the-board 25% capacity limits that we adopted on December 26th for at least another 2 weeks until 5 a.m. on Monday, February 8th. As hospitals continue to stabilize after the holidays and the average positive case rate declines, we hope to see those trends continue moving forward. And if they do, we'll be back to talk about lifting some of the restrictions that are currently in place as soon as it makes sense to do so that people can get back to work and back to normal over the coming months. The Lieutenant Governor will talk a little more about this in more detail shortly. Today's announcement does not impact the K-12 guidance. As the science and medical data makes clear, in-person learning in many respects is the safest place for our students to be. Even in communities with high infection rates, our school districts have reported limited cases of COVID-19. And we've created ample resources for schools to safely return to in-person learning, including nearly $1 billion in funding guidance supported by pediatricians, and resources for testing. We encourage all districts to take a look at the pooled program that's been developed by DESE and by the Command Center, and to incorporate that into a return to in-person learning strategy to best support students and families. While today's announcement reflects another step toward normalcy, we still have a lot of work ahead of us to suppress the pandemic once and for all and to fully reopen our economy. As I mentioned before, the decisions to place any type of restriction on businesses is not one that any of us takes lightly, and we appreciate that there's been an exceptional impact on nearly every sector of our economy. In October, we announced a grant program through the Mass Growth Capital Corporation to benefit small businesses that have struggled mightily during this pandemic. After our successful start, our administration infused additional dollars into this program to create the largest operating grant fund in the nation using COVID-19 funds. A total of $720 million has been invested to support this program to provide assistance to small businesses across Massachusetts, especially in the industries that have been hit hardest, like restaurants and other indoor entertainment venues. Today we're announcing that 638 more grants are being awarded to businesses, totaling another $37.5 million. To date, this grant program has awarded $232 million in grants to 4,757 businesses in all regions across Massachusetts. The remaining funds will be awarded to other small businesses in the coming weeks. The intent of these grants is to keep these struggling businesses operating, to cover their operating expenses, and to help them make their way through this second surge for up to 3 months, or $75,000. Last week, the Lieutenant Governor and I visited a North End restaurant to talk to the owner about how this money had helped him and his staff get some financial relief. As our vaccine program continues to ramp up, we know that many businesses will have a tough couple of months in front of them, and this program is meant to help them bridge that gap and put them in a position to stay open until we get back to something like normal. COVID-19 has clearly emerged to be the most remarkable and damaging global pandemic in our lifetime. Every resident has been affected by this merciless virus that respects no boundaries and in some cases can be sadly deadly. Our administration has and will continue to work hard to stop COVID-19 spread, to administer vaccines, and to get our economy back on track. Today, there are some glimmers of hope as some public health trends show some retreat and businesses can get some financial relief and resume activity. But there are still many challenges ahead for us, and the best weapon we continue to have is prevention, patience, and vigilance. We'll continue to monitor the new variant that's now come to Massachusetts, although we believe it was here weeks ago. We continue to implore everybody to wear a mask, to avoid groups, and to stay home if you're sick, and to spend as much time as you can with those in your immediate household. At some point soon, we'll be on the other side of this virus, but we got to keep working this a little longer before we get there. And with that, I will turn it over to the Lieutenant Governor.
Thank you, good afternoon. Thank you, Governor, and good afternoon. As our healthcare system continues to stabilize, I'd like to again commend the hard work of restaurants and businesses throughout our Commonwealth. Since the pandemic began, businesses have pivoted their operations and have met the state's safety guidance to keep their customers and employees safe. Governor Baker and I have been able to visit a few businesses to see the product of this work, from new outdoor and patio spaces to new and creative takeout options. Continue to support your local businesses. You know where they are. Shop at their store on your main street or in your downtown. Pick up some gift cards, and also just take out when you can, and just remind your friends and your neighbors to do the same. As the governor announced, we're able to begin carefully lifting restrictions, and that businesses previously required to close early may now operate past 9:30 p.m. effective January 25th at 5 a.m. That includes, as a few examples, restaurants, arcades, and other indoor and outdoor recreation in Phase 3, Step 1 only, indoor and outdoor events and other gatherings, movie theaters, outdoor recreational experiences, casino and horse track simulcast facilities, driving and flight schools, close contact personal services like hair and nail salons, museums, and gyms. The full list of industries will be posted at mass.gov. Liquor stores and other retail establishments that sell alcohol will now be able to sell alcohol past 9:30 p.m., and adult use cannabis retailers will also be able to sell cannabis after 9:30 p.m. Phase 3, Step 2 businesses will remain fully closed. As the Governor said, for now, the 25% capacity limit remains in place until Monday, February 8th. As we've said before, these are difficult decisions, but they are needed temporarily in order to slow down activity and keep schools open and keep our economy running. We are pleased to award today critical direct financial support to 638 additional businesses. Among the small businesses receiving awards in this round are close to 200 restaurants, dozens of independent retailers, businesses that offer professional services, personal care and beauty services, as well as education and healthcare, and among other hard-hit industries. Almost half the businesses receiving support in this round are women-owned. Nearly 200 are located in gateway cities or serving underserved markets. And 82 of today's awardees have received no prior financial support. Thanks to this fourth round of grants, we've now awarded about $232 million to protect and preserve these businesses, as well as their families and workers, as best we can. Before I turn it over to Secretary Keneally, I urge everyone to remain vigilant and to continue to take this seriously so that we can keep our businesses open and our economy running. Wear a mask, wash your hands, stay healthy, and take care of one another. We look forward to continuing to support small businesses in every corner of our Commonwealth, and we look forward to the light at the end of the tunnel. Thank you, and I'll now turn it over to Secretary Keneally.
Well, thank you, Governor, Lieutenant Governor. As the Governor and Lieutenant Governor said, we're pleased to be able to deploy this critical support to the businesses that are most in need. And we again praise our small businesses for their patience and their help in stopping the spread of COVID-19. I'd like to underscore a few themes that have been raised today. First, the importance of our small business workforce. Small businesses accounted for over 40% of the Commonwealth's pre-pandemic workforce. In real numbers, that's the equivalent of about 1.5 million employees distributed throughout the state. And it's that workforce who operates an extensive network of small businesses that is fundamental to the health of the Massachusetts economy. Understanding how much pressure the pandemic has put on these businesses, including their families, their communities, and their workers, it remains a top priority for us to provide relief with the urgency that this situation calls for. Second, by providing direct financial support, we can help offset a little of the unpredictability caused by COVID-19. To be successful, businesses need the ability to plan ahead. But for 11 months now, this virus has compromised virtually every tool and tactic previously used to get a glimpse into the future. Changes like the shift away from working in an office to working from home, or the dramatic drop in foot traffic where it used to be ubiquitous, have completely upended conditions that used to offer stability. And of course, there are no corresponding changes to the ordinary costs associated with staying open. By providing direct support, we can help mitigate some of that uncertainty and provide some stability. Third, our plans for near-term recovery and for long-term growth absolutely includes our network of small businesses, the families that run them, the workforce they employ, and the value that this key sector collectively adds to our economy. We'd like the post-pandemic small business landscape to not simply reflect the diversity that was there before, we want to far exceed that. Our agenda will continue to prioritize access to capital, space, and networks for women and minority-owned businesses. We designed the first round of our grant program to target resources to businesses located in hard-hit communities and those that are owned by people of color, women, and other underrepresented minorities, especially those businesses and sectors that have faced severe losses during the crisis. The second round of the program, launched out of the relief fund announced in December, will also target those sectors most highly impacted, and we look forward to announcing those grants in February. And I want to close again by expressing my deep gratitude to Larry Andrews and the team at Mass Growth Capital, who have literally been working around the clock to process these applications and to get this critical funding out the door as quickly as possible. Thank you.
Questions?
Governor, choosing the curfew to be lifted over the capacity, can you just explain that, just kind of the thinking behind why we went with the curfew instead?
Well, people need to keep in mind that the stay-at-home advisory that we put in place from 10 to 5 back in early November was sort of built on a stay-at-home and be safe advisory that was in place prior to that. The capacity limits only got put into place right around the Christmas holiday. I think from our point of view, the drop in hospitalizations, positive cases, and percent positive cases, even though we've continued to test at a significant level, justifies making modest adjustments to our current program. And the one that we believe was most appropriate, given both when it was put in place and how long it's been there, is the one that was associated with the overnight stay-at-home.
You had mentioned in, I guess, over the holidays, social media had you Scrooge. How do you think it will play now with businesses getting a chance to open?
I've sort of given up trying to figure out what the basic sense of the reaction to a lot of this stuff will be. We talk to a lot of people, both before and after these decisions get made. We get a lot of mixed point of view and opinion, and we absolutely recognize and understand that every one of these decisions since last spring comes with enormous trade-offs, and it's a big part of what makes COVID such a difficult and, in many respects, traumatic issue for people.
The variants, you mentioned that, but
Yeah.
still opening things up a little bit more. How big of a concern are they right now? Obviously, you're comfortable enough to do what you're doing.
So we got asked about the variant, I'm thinking about 2 weeks ago, when it first showed up in Colorado. I think it first showed up in the UK, but then people started talking about when it might make it to the US, and I think it was about 2 weeks ago that it showed up in Colorado. States have been sending data to the CDC, including us, and states have been doing some of their own runs to see if they can locate the variant themselves. And we said at the time that even though we hadn't found an actual confirmed case, that we believed it was already here. The best way to deal with that variant is to do exactly the same things we've been asking people to do, and people for the most part have been doing for months, which is, wear a face covering, maintain your distance, don't go to a lot of informal gatherings, don't go to any if you can avoid it, and try to spend most of your time with people who are part of your immediate household. The vaccine, just to repeat this because it's important, all the vaccines that have been approved, plus the ones that are currently in clinical trials, have all been deemed to be effective and safe in dealing with a number of variants associated with COVID, including the one that people have talked about most recently. The big issue with this one is COVID is very aggressive with respect to its ability to jump from person to person. This variant is more aggressive. So the best advice we could give people is to continue to do the same thing. But our view is it was already here.
Governor, we're hearing from Western Massachusetts lawmakers that they're already vaccinating people in phase 1. They want to move ahead. Is that something that you're looking at?
Say again?
So several Western Massachusetts lawmakers say they're already vaccinating people in phase 1 and they still have extra vaccines. They're ready to continue with their vaccine process. Would you allow municipalities to move ahead with that?
So what I would say is that if folks believe that they've vaccinated all their home health workers, all of their frontline healthcare workers, all of their first responders, all of their nursing home residents, and all of their nursing home staff, which is phase 1, which is currently open, they should talk to the command center about that. I don't believe that any part of Massachusetts, based on the data that we see every day, has been able to vaccinate first shots only, first doses only, everybody in those categories in their communities.
But even like Pittsfield and, communities way out west, they're seeing, lower population numbers, they're ready to move on. They say they're just waiting on the state to give them the ability to.
Like I said, if people believe they've hit all the people in those categories who want to be vaccinated, obviously, then they should be talking to the command center about that.
Governor, with this curfew having lasted roughly 2 months, what would you say the impact was? Do you think it was effective having the advisory curfew for folks and also the curfew for businesses in this respect in reducing the spread of COVID-19?
Look, I think the fact that we've seen very positive numbers since the beginning of January is an indicator of 3 things. Number one, people took to heart our messaging around Christmas and New Year's, okay? We continued to see some of the momentum that came out of Thanksgiving after Christmas and New Year's, but we did not see anything like the sustained and dramatic spike that we saw in new cases every day and hospitalizations every day that came after Thanksgiving. So, it's always hard to draw really specific conclusions about some of this stuff, but it does appear to us that people were really careful and cautious through that whole Christmas and New Year's period, which is a really good thing. I know it stinks to some extent with respect to how you would like to spend that holiday, but here we are, it's 3 weeks later, and over that period of time we saw a 30% drop in case positivity, a 30% drop in new cases, and a 10% drop in hospitalizations. First time we've seen any drop in those numbers for quite a while.
And you said there are 3 things. I'm sorry. What were the other 2 big indications or reflections?
Positive test cases, positive test rate, hospitalizations.
I know you addressed vaccinations at Gillette, but I just wanted to ask again, is this purely a supply problem from the federal government releasing and authorizing them, or is there another kind of distribution error somewhere in the pipeline? Is it just the state can't get enough from the feds?
Well, we can't plan to build infrastructure if we don't know what's coming, okay? And generally speaking, our visibility into what we can expect is 1 week. That makes it hard to draw conclusions about how far you can go beyond that process. As I said today, based on the number of people who've been vaccinated, who were part of the early part of phase 1, we now believe anybody in phase 1 should go to the website, find a site near them, and go get dosed, because they are now open, all of them. And part of the reason we went to Gillette today was to celebrate the fact that we now have a mass vaccination site that was doing 100 cases a day at the end of last week and are going to do 1,500 a day today, and will ramp their way up to 5,000, who are serving basically healthcare workers and first responders, both key elements of phase 1. But we'll continue to roll out additional capacity, but the speed with which we roll out the capacity is driven to some extent by what we believe the scenario is going to be with respect to how much additional vaccine we get from the feds. I continue to believe that if the J&J vaccine, which is just finishing its clinicals, gets approved, and the AstraZeneca vaccine, which is also in a similar place, gets approved, you're then going to have 4 companies making vaccine and distributing it as part of this program, and that all by itself will significantly expand what the feds will be able to distribute and what we'll be able to put into vaccination sites and into people's arms.
Are your initial estimates to when phase 2, when phase 3 begin, are they still on point based on what's happened in phase 1?
More or less. I mean, plus or minus a week or two. And we never viewed them as being anything more exact than plus or minus a week or two because we didn't have enough visibility into what we thought would be happening with respect to the distribution process to begin with. I do think one of the things I'm a little nervous about, and I said this down at Gillette, and I said it 2 weeks ago, is I was hoping there would be a lot more connectivity between the outgoing administration and the incoming administration so that we would never lose a moment or a beat or a second on the process of actually executing on this critical part of the rollout, which is the stuff in the pipeline to get approved as well as the stuff in the pipeline to get manufactured and distributed. The Biden administration is talking about 100 million shots in 100 days. The country's currently doing about 800,000 shots a day. So that's about a 25% increase if you go from 800,000 a day to 1 million a day to hit 100 million in 100 days. I don't expect it to be this kind of a line. It's probably going to be more like this kind of a line. But getting visibility into sort of when that line is going to start to go up from the current distribution pattern would be really helpful to us in terms of signing contracts and opening up sites to start to vaccinate much bigger number of people.
Governor, losing Secretary Powell to the Highway Administration, does it change your administration's approach to sort of, major questions like transportation, the project in Alston with the highway and how you fund transportation? And what changes or does it change how you go about things for at least the next 2 years?
I think the biggest, first of all, Lieutenant Governor and I were talking about this yesterday. Stephanie Pollack has done a terrific job, and it was in many respects one of the most difficult jobs anybody faced coming into our administration. And we are thrilled to see her skills and abilities recognized to the point where she's basically going to be the number 2 at the Federal Highway Administration in the new coming administration. I think Massachusetts is losing a terrific performer, but I also believe that we now have somebody in the federal government who has a pretty deep knowledge and understanding about what the state of play here is with respect to, projects, requirements, where we are, what we need, and all the rest. And instead of having it on a form, which somebody may or may not fully appreciate coming in from 50 different states about what you're looking to accomplish, when we submit applications to FHA, we're going to be submitting applications to an agency that's led by somebody who actually knows what's actually going on here, which I think is a really big deal. But most of our policy was developed by the Secretary and by our team, and I would expect that a lot of it would continue as is. I do think the players changing complicates things, not just on that front, but, Mayor Walsh, we have a lot of stuff we're doing with the city of Boston, right? It'll be interesting to see, or a little complicated to see how that plays out as, his departure comes and he goes, and then Mike asked me about a home rule petition last week. If there is no home rule petition, it's theoretically possible you could have four mayors in the course of a year. And a lot of this stuff we're working on requires a certain amount of contextual history and knowledge about what needs to happen going forward too. So I think in some ways Secretary Pollack's departure is great for her. I believe it's great for the country because we think she's a terrific administrator and manager. And And it's a bummer for us, but we do now have somebody in Washington who really understands kind of what we're about here, which is great.
Are you expecting anyone else from high level of your administration to lead the new administration in DC? Do you have any sense of that?
Well, if you told me at the start of all this that I was going to lose 2 members of our medical advisory board, the mayor of the city of Boston, the governor of Rhode Island, and our secretary of transportation in the space of about 20 days, I would have taken that bet. So the answer is I don't know. I mean, it's possible, I suppose. I think there's a lot of really talented people around here. And I would, and I would certainly argue that there's more than enough to do at the federal level if others choose to go to Washington. But obviously, it means we have work to do to figure out how to make up for those losses.
Governor, would you be, how long would the process be to keep Jimmy Tesler's acting transportation secretary, and are you looking for anyone outside to fill that role permanently?
This has just happened, okay? And it happens fast. I mean, I think our last day is like tomorrow or Monday. I mean, it's like, so we have not thought long and hard about a lot of this. I give Jamie enormous credit for being willing to be the acting. He has worked at DOT, he's worked at the T. He's done a great job, in my opinion, in our opinion, at the registry, and he has a good support team there, so we're not worried about sort of what will happen at the registry in the meantime. And he makes it possible for us to have somebody who literally is leaving in the space of sort of 72 hours plus or minus. He'll make it possible for us to create a plan and pursue a strategy for replacing the secretary that will be able to be thoughtful and will give us some time to think about what we want to do there. And I give him huge credit for doing it.
Thanks, everybody.
I just wanted to ask, President Biden had indicated that he's going to be leaning on FEMA and the National Guard to maybe set up some federal vaccination sites. What do you think the possibility is that one of those might open en masse, and have you heard anything about that?
We haven't heard enough from the federal government to have much idea about that. In fact, we just finished a 7-day mission with the Guard here in Massachusetts, where a significant number of them were in Washington. We've talked to a number of people individually before they took office who are currently serving in some of these key roles. Obviously, Rochelle Walensky and Eric Lander are part of our advisory board, so we've talked to them. We haven't talked to them, but we haven't talked to anybody in the last 48, 72 hours. And I am hoping that we'll start to have kind of a regular dialogue with the folks that are in charge of a lot of these issues in the Biden administration, so that there can be discussions about things like exactly that. What would be the best way for them and for us, based on rules and regulations, requirements, protocols, and all the rest, to staff the kinds of vaccination capacity that we'll need to really get to the point where we can vaccinate the number of people we need to vaccinate as quickly as we will need to do it, if the vaccine supply is there to support it. Thanks.